Usapang kalusugan sa Health Check Plus. Alamin ang mga payong medikal mula sa mga totoong eksperto. Ang kaalaman ay kapangyarihan. Usapang kalusugan sa Health Check Plus.
Magandang araw Pilipinas, sana lahat po kayo, ating mga kababayan maging saan man ang panig ng mundo ay nasa mabuting kalagayan. Kasama po natin ngayon ay isang doktor. Siya po ang namamahala ng Commission on Population and Development o POPCOM. Marami po siguro sa atin ang hindi na pamilyar o alam kung ano ang POPCOM. Birth control, reproductive health, condoms at IUD, yan marahil ang pumapasok sa isipan kapag narinig ang POPCOM. Kaya ang unang tanong po natin kay Yusek Juan Antonio Perez III ay kumusta na ang POPCOM sa panahon ng pandemya? Doc GP, kumusta na po ang POPCOM ngayon?
Well, ang POPCOM ay patuloy sa pag-implement ng population programs and policies ng government. Tatlo yung major programs na inaasikaso ng POPCOM. Yung isa yung Responsible Parenthood Family Planning Program, which, as you mentioned, covers the need to promote and ensure the use of modern family planning methods by Filipinos, couples and individuals. Dahil marami pa rin ang nangangailangan ng family plan methods sa ngayon. We count around 3 to 4 billion. And then we have also the Adolescent Health and Development Program. The idea is for young people to achieve yung potential nila. And among the threats to their achieving their potential is risky behavior that leads to higher adolescent births and mga risky behavior that leads them to not being able to participate fully in society. And the third is population development as part of general policy in development in the country. That any development activity in this country should center on the people. Hindi yung development na hindi kasama yung interest ng individual, ng population. So those are the three major programs namin, and we have been working very hard with the Department of Health and other agencies to implement, importantly under this administration, the RPRH law. Kumbaga kaming dalawa ng DOH magka-partner sa pag-implement ng family planning and make sure din ma-implement ang RPRH law, which is now on its 8th year of implementation.
Yes po. So, Doc, parents, the youth, and population development, yun po yung inyong areas of work po, and closely with DOH for the RPRH law. Yun po. Doc, kamakailan lamang sinabi nyo na pinakamitindi ang tama ng COVID-19 sa mga mahihirap dito sa kalunsuran at lalo na sa kanayunan dahil sa wala silang kakayanan na magpagamot po. Pwede nyo po bang ipaliwanag, Doc, yung sinasabi nyo po, I guess this would relate to the general population and yun nga sa mahihirap. Yung sinasabi nyo po na parang mas nahihirapan yung mahirap, whether urban or rural poor po na magpagamot because ano po ba itong ibig nyo pong sabihin?
Well, ganito yung nakikita namin. Last pa, tinignan namin na ang pinaka-vulnerable sa COVID ay yung ating mga communities. Dito nagsisimula ang COVID. And it has been our working theory that yung communities natin that are vulnerable are those na maraming bahayan na dikit-dikit na maliliit ang bahay. 20 square meters or smaller ang bahay, tapos 5 yung natira. So you actually have 4 square meters per person. Pangalawa, on top of the 5 or so members ng household, merong senior citizen na nandun. So lalong vulnerable ang senior citizen because naka-target sa kanila yung COVID, comorbidity. 50% of senior citizens have comorbidities. And finally, may mga bahay na senior citizens lang walang kasama on their own. Nakita namin in an area like NCR, there are around one-third of the population is living in houses less than 20 square meters. And tiningnan namin based on the census kung saan ang mga barangay na maraming kabahayan na maliliit at dikit-dikit ang mga tao. Mga prime example dyan, mga community katulad ng Addition Hills sa Mandaluyong, where you have 107,000 people living in an area that is around 1.5 square kilometers, no? Square kilometers. So, dikit-dikit dyan. And sinasay ko rin yung example ng Wakwak, where you have 3,000 people living in an area 1 square kilometer. So, 3,000 versus 107,000 living in basically the same space. And nakita namin na may tendency, ang simula ng COVID, nagsimula sa mga lugar katulad ng Wakwak. Ang Wakwak has a golf course. May naglarong Singaporean doon. And may COVID pala yung Singaporean. So he was the first case detected in Mandaluyong na may COVID. So unang nagkaroon ng cases sa Wakwak, sa Highway Hills, mga condo, maraming condo yan. Walang kaso noon pa sa Addition Hills. Pero by the end of sabihin natin, by end of May last year, marami ng kaso sa Addition Hills. Nag-flatline na doon sa Wakwak. Wala nang kaso doon or nag-modify na. So what happened was COVID, which had originated from outside the country and was brought in by tourists, by OFWs, quickly spread throughout the country, in urban areas. Una sa mga community nitong mga taong to, but more significantly, they took root in communities like Addition Hills, Pinagbuhatan, Commonwealth, where even now, on the second year of COVID, tuloy-tuloy pa rin yung nakikita natin kaso. In Addition Hills, you now have up to 2,000 cases and 52 deaths. While in they had 5 deaths throughout the whole period. So what happened was, nagsimula in these gated communities, but nakontrol doon, pero hindi pa rin nakokontrol sa urban poor communities like this, kung saan patuloy pa rin kumakalat ang COVID at hindi na-root out. Which is why we did another study, itong demographic vulnerability ng communities. Kumuha kami ng pag-aaral, saan ba pinakasiksikan ang population? Saan nagsisiksikan ang mga tao sa limited area? So we got the land area of all the barangays in the country. Unfortunately, sabi ng DNR, 35,000 lang ang barangay na may land area na nasukat. So another 6,000 walang nasusukat na land area. So pero we did best with the 35,000 and we classified barangays according to the population size and the land area nila. And we determined na yung standard land area would be 200 per hectare. 200 persons per hectare. Yun yung norm.
Persons per hectare.
Which is around 50 square meters per person. So sabi namin, eto siguro ang... So fall below this, then you are low or medium density population.
Yes.
If you are over 200, you have high or very high density. So, classify namin lahat ng barangay in the country according to that. And we are providing that information to all local government units para tingnan nila, doon ba sa high density barangay, katulad ng Addition Hills, nandun ba yung mga kaso, nandun ba yung mga namamatay? And should they focus on those? Kasi nakita namin yung high density barangay, over the same period, they had 137 na namatay over an 8-month period. September 2020 to April 2021, an average of 137 namatay doon sa high-density barangay. Doon sa low-density barangay, ang namatay was only, kaso pala is 137 sa high-density barangay. Ang kaso ng COVID sa low-density barangay is only 19. So, 6 times mas marami yung kaso ng COVID dun sa high-density barangay.
Opo. Doc, meron pong report yung Popcom. Yung pong kinikwento po niya sa amin tungkol sa low density. Does this really your report din na meron pong 1,200? Ito po ba yung relate po sila sa kumbaga po ng population ng mga nakatira?
Yes. Nilista namin lahat ng high-density barangay na may kaso ng COVID. And average namin, and with 1,272 barangays, 58% of them are in NCR and the bubble. No? 58% ng high density. Okay. And yun yung average na lumabas na 137. And pagdating sa mga namatay, in those barangays, 3.3, 3.4 deaths ang nangyari in 8 months.
Opo.
Sa low-density barangay, it was 19 cases, in 1.8 yung namatay in 8 months.
But parang kalahati. Tapos cases would be six times more in high density places in compared to low density places. And yun, Doc GP, sinabi niyo po kanina na ginawa niyo pong available ang data na ito sa mga local government units, yes, especially the barangays. Pupunta po ako doon. So how did they use the data, Doc? GP, were you able to monitor if parang how did they appreciate the data? May ginawa po ba sila patungkol po dito sa implication po ng data po nito?
Well, last year pa, when we first provided the information tungkol sa masisikip na kabahayan, ginawa ng ibang LGU, ginawang basis ito para sa AIDA. So, nagbilang sila ng mga kabahayan at nag-focus sila sa mga lugar na maraming siksikang barangay. Dahil parang indicator ng poverty eh. Kung siksikan yung mga kabahayan na maliliit, then it's an indicator that the barangay has a lot of poverty. Ibang LGUs nag-adapt nitong datang ito para sa kanilang mitigation. No? Ibig sabihin, yung babantayan nila, yung mga barangay na marami kabahayan na dikit. Doon sila nagla-lockdown kung minsan para tinatawag ng granular lockdown. And may isa pang agency na sabi nila, yung Department of Housing and Urban Development, Human Settlements and Urban Development. Sabi nila they would use the information for future recommendations on housing. Pero during that time last year, hindi pa namin kinoconnect yung mga barangay na to to the cases and the deaths. Kasi March, mga April, May yun wala pa masyadong kaso. And it was only in September last year na nilagay na yung mga barangay yung address na barangay ng mga COVID cases. Up to September, wala yung data on barangay. So we could not plot the data. But since September, DOH has included the data on barangay doon sa cases. So we were able to come up with this study. And of course, kinolect pa namin yung land area. It took some time. So ngayon namin put together lahat ng data. And we have provided, actually DOH wrote us 2 months ago. Sabi nila, pwede bang mabigay niya yung population density ng mga barangay? That's why we have been working with DNR at that. And now, nilink namin sa cases. So I hope and I believe DOH will use this in the next phase ng vaccination.
Opo.
The first phase is, di ba, sectoral, A1, 2, 3, 4. At a certain point, DOH will have to shift to a geographic focus. Immunization has always been based on geographic, on reaching every barangay. Yan yung slogan ng DOH eh. Every barangay must be given yung immunization kung sa bata o anuman, ang target talaga is the barangay. So, I presume, pagka medyo masaturate or hindi na masyado nag-move yung mga sectoral approach, the DOH and the IATF will have to go on a geographic approach. And this is a way for them to prioritize. Pwedeng unahin ang mga barangay na high density, na mataas ang cases, mataas ang death, and then isunod yung ibang priority barangay. But I would advise and na yung mga mayor, tingnan yung density at tingnan yung datos nila. Because the DOH data sometimes is incomplete pagdating sa death, pagdating sa case. Lalo na sa death, I think, ang Addiction Hills, nakalista sa LGU, 52 na yung namatay in one barangay.
Opo.
Pero kung tingnan mo yung DOH data, 13 lang yung nakalagay na death.
Opo.
So behind ko minsan yung data. And alam mo naman, naglabas ng data ang PSA early this year na yung namatay sa COVID last year.
Yes, Doc.
By their is already 7,000. Pero yung nabilang lang ng DOH ay 9,000. So that means ang labanan sa COVID is happening in the community. No, lahat tayo, we have this vision na yung COVID, yung labanan ay sa hospital.
Yes, Doc.
But if you look at it, yung napupunta sa hospital, sila yung casualties ng gera sa community. Sila yung pinaka-complicated. Sila yung mga matatanda. So parang gera where the hospitals are where you bring the casualties. But
Yes,
where
Doc.
is the fighting actually happening? It's actually happening in the poor communities.
Opo.
That's why ang stand namin is mag-focus tayo sa communities. We agree na hindi dapat i-neglect and we should improve our hospital system. The hospital system is being heavily challenged because we are not doing enough at the community level, which is where you do primary healthcare, which is where we have been doing immunization for time immemorial, time pa ng DOH, ng time ni Marcos, hanggang time ni Flavier. Yung barangay talaga yung tutok ng public health.
Opo.
The hospitals are the final line of defense. The first line of defense is actually community. Yun yung aming sinasabi. The communities are the most vulnerable. That's where we should focus our
Yes,
work. And naglabas na ng Joint Memorandum Circular ang DOH, DILG, DICT, and NEDA, and POPCOM is included with NEDA, na magbuo ng mga composite team. Bawat barangay may composite team.
Yes, Doc.
Na para ma-refer ang mga to. Pero, ang daming barangay, 42,000 barangays. Baka pwede mag-focus sila dito sa 1,200.
Yes po. Doc, yung buong discussion po natin, especially po yung considering the battle lines na sa communities po. Dito po kanina, nagmula po sa discussion natin on high density and low density relates so much about to population growth. So, ang tanong ko po patungkol sa umaabot na yung populasyon natin ng more than mahigit 110 million. So, tapos nabanggit niyo po dati, I've heard that you mentioned dati na merong ibang klaseng pandemic in relation dito sa ating population growth. Ano po yung ibig niyo pong sabihin po dito po in relation to population growth? Yung ibang klaseng pandemic. Opo.
Yes, ang impact ng pandemic sa population growth is we are presuming there will be a an uptick, taas ng konti yung population growth than normal. And basically, because we now have almost 8 million women and men using family planning. Pagka ang impact ng COVID is bumababa yung provision ng family planning. So actually, ang initial report sa amin ng Department of Health, Field Health System, ay nabawasan ng 1 million yung gumagamit ng family planning.
Ngayong araw po ng pandemic, ay panahon ng
Yeah,
pandemic.
ng period ng pandemic
no?
yon, 2020. Actually, this is a report from
Opo.
2020.
Opo.
So pag ganun kalaki yung impact na hindi gumagamit ng family planning, 1 out of 3 might become pregnant na hindi planado.
Yes.
So that would
Doc,
mean
opo,
anywhere from 200,000 or more
na
ang
taas.
mabuntis on top of the normal na pagbubuntis.
Yes. Additional 200,000 po na top from normal. Doc, nabanggit niyo po yung unplanned pregnancy and ngayon po, particularly on adolescent unplanned pregnancies, ano po ba yung sa tingin niyo po ugat po ng tinatawag na yung crisis po nito patungkol sa unplanned, yung specifically po for adolescents?
Yes, ganito yung kwan namin. Overall, yung teen pregnancy na 10 to 19 has been fluctuating. Umabot ng 209,000 per year, pero it has gone down to around 180,000 in 2019.
Doc, ano po, yes, Doc GP, yung sabi niyo po, teen pregnancy relates to pregnancy sa mga women from ages 10 years old po?
Yes, 10 years old ang pinakabatang tatala. Tapos,
okay,
focusing on pag-teen pregnancy yung hanggang 19.
Opo.
Currently, we have started to focus on grupo na 10 to 14 years old, as you said, no? And we saw a doubling of the number of 10 to 14 na nabubuntis. In 2008, it was about 1,000. However, in 2019, we saw 2,400. So from 3 per day, naging 7 per day. Ang pregnancy among 10 to 14.
10 to 14 years.
And then,
Opo.
yung tinignan din namin yung 10 to 17, mga minors.
Opo.
Because I said around 180,000 ang teenage na nabubuntis, around 120,000 of them are 18, 19 years old. So they're adult na sila, they can get family planning on their own. Pero yung minor, yung 600,000 or so who give birth every year na minor, they're not allowed to get family planning services kung walang
consent ng parents.
So we saw an increase then from 58,000 before the RPRH law, tumaas siya to 66,000, 67. Then it went down to 64, and then ngayon nasa 62,000. But it's staying there above 60,000. That's why we're campaigning for legislation to address itong pregnancy among teenagers, but more specifically sa mga minors. Because they do not have access to family planning services and other RH services.
Doc, GP, aside from your campaign to push for a legislation to address teenage pregnancy, medyo kulang na po tayo sa oras. But can you share po what the government and the POPCOM is doing to address yung crisis po on unplanned adolescent pregnancy?
Yes, we're starting a program called the Challenge Initiative, which is focused on cities. Alam natin, karamihan ng mga adolescent births are happening in the cities because all minors are supposed to give birth in a hospital. Hindi ka pwede manganak sa lying-in. That's the requirement of DOH. So many of these girls are giving birth in cities where the hospitals are. So we're focusing on the cities to put up a program that's adolescent-friendly and focused on addressing the family planning needs of minors including a social protection program. So, sumama na rito ang tatlong syudad, Cagayan de Oro ni Mayor Moreno, Puerto Princesa, Mayor Byron, and Dipolog City, si Darrell Uy. So we have already 3 mayors who are willing to take up the cudgels, so to speak. You know? And we are adding at least 1 city per region para may example tayo on how to address itong increasing teen pregnancy, adolescent births in the cities. Yung mga nanganganak sa city kasi kahit na hindi sila taga-city, at least sa hospital ng city, masimulan yung information about the need for family planning, reproductive health. And our major thrust here is no more repeat pregnancy. Dapat zero na yung mabuntis uli habang minor. No? Don't get pregnant again. And for that, you will need a family planning service. And so kapartner namin dito ang mga LGU, ang DOH, ang Zwelig Family Foundation, and right now, with DSWD, we are developing a social protection program for teen mothers who are minors.
Wait, Doc,
and their children.
Opo. Would it be possible para po sa inyo na quickly na lang, i-share lang po yung sinasabi niyong social protection aspect po nung pag-address sa adolescent teenage pregnancy or pregnancy sa minor? Kasi ito po, so it's done, nabuntis na po sila, so they're girl moms, and then meron po kayo sinasabi na you give social protection to them. What specifically, or ano po yung component po nitong social protection na support para po sa mga girl moms? Opo.
Yeah, actually, we started developing this in January this year because there was an insertion in the budget of DOH and DSWD asking us to develop this program, and specifically for teen mothers and their children. So it will begin with a good information system, so we can identify all the teen moms who are minors and their children. It will have as a component health services for the mother and the child. It will also have support for nutrition, early breastfeeding, weed foods for the child, also mental health aspect. Return to school by the mother. No? Okay? It's been proven yung batang ina na ay more likely na hindi tapos ng kanyang pag-aaral. So we want to have a program that will bring them back. Maybe vocational education will be open. And finally, we're thinking about setting up a social amelioration program until they are independent, to support the poorest teenage mothers until they're more independent. Siguro when they're 18, above 18, parang we support them like we would solo parents. But unique ito dahil solo parent, bata pa, no? Batang ina na solo parent. They can't get married because of the
family.
So that is in a way, the essence of the program that we are developing with so many agencies. Hindi lang mag-iisa ang POPCOM, DSWD, or DOH. Maraming kasama rito. So we're working on that mandate, and we hope to roll it out actually next month. May agreement na kami with Secretary Bautista. We'll sign the partnership with DSWD.
Yes po. Okay. Doc, last na lang po bago po tayo mag-end. Doc, yung profile po, you said kasi, yung target niya, because yun nga yung requirement, would for the batang ina to give birth sa mga cities. Pero po, yung profile po ng mga nabubuntis na minor, so those from 10 to 17 years old, ano po profile po nila? Asang community po sila galing, and yun po, ano pong nakita ninyong na description po nung karamihan po sa kanila?
Well, they tend to be still from rural areas. They tend to be poor. Around 50% are poor. And ang tingin namin, they have they lack the skill to negotiate. Ibig sabihin, yung autonomy nila is compromised. No?
Oh,
The intention, kasi yung batang ina, may kapartner yan, ano? Na ama. And ang tendency, mas matanda yung ama.
okay po.
So 20 years or older, meron pang 70 years old.
Okay po.
So that is the situation that we're seeing. They're not in an independent position.
Yes po.
They're poor, rural, tapos mas matanda pa sa kanila yung partner nila. So they're always at a disadvantage. So we look at it also as a rights issue na nako-compromise yung right ng kabataan that their individuality, their autonomy as an individual is compromised by this situation. That's why
Yes po.
it's very important na ma-address ang adolescent pregnancy, particularly for minors.
Yes po. So, thank you po, Doc GP. So, thank you for components of your social protection. Get out next week. And we hope to invite you again sa conversation about autonomy, lalo na po women's autonomy, nabubuntis po natin na minors. So, maraming salamat po sa inyo. Huwag po kayong aalis. Ang tabayanan po si Dr. Ruby Roses ng Centro Estetica sa Wellness Tips. Paano maging maganda pa rin kahit naka-lockdown ang aming pag-uusap.